student nurse, and I'm going to be giving you your vaccine today.
Perfect.
So can you confirm your name and date of birth for me, please?
McKenna Paisho, March 9th, 2005.
Okay, McKenna. And have you received the influenza vaccine as of October 2021?
No.
Okay. Do you live, work, or go to school in Alberta?
Yes.
Yes? Okay, so just some questions for you before we start. So are you feeling well today?
Yes.
Do you have any allergies?
No.
No? Okay. Have you ever had a reaction to a vaccine before?
No.
Okay. Do you have a health condition that has required a recent doctor's visit or will require a doctor's visit on a regular basis?
No.
No? Okay. Do you take any medications regularly?
No.
Is there any chance that you're pregnant?
No.
Okay. So just some information on the vaccine before we get started. So influenza is an infection of the nose, throat, and lungs that is caused by a virus. Immunization protects you from this disease. Immunization will strengthen your immune system by creating antibodies, which help fight against diseases. Immunization is completely safe, and it is much safer to get immunized than it is to get this vaccine, okay?
Perfect.
Okay, so the antigens that are in the 2021-2022 vaccine is A, Victoria, A, Cambodia, B, Washington, and B, Phuket. So after you get the vaccine, you may experience some side effects. They can include redness, swelling, and discomfort where the needle was given, crying, feeling tired or irritable, headache or body aches, fever or chills, loss of appetite, stomach pains, diarrhea, nausea, or vomiting, okay?
Sure. Yep.
Okay, awesome. So if you experience any of these side effects, you can make yourself feel better by applying a cool, wet cloth where the needle was given, drinking extra fluids and wearing less clothing if you have a fever, and moving the limb where the needle was given just to help the vaccine absorb.
Right.
Okay, awesome. As always, if you need any more information, you can go to myhealth.alberta.ca. Unusual reactions can occur, and if you do experience an unusual reaction, we want you to call the health link at 811 just to report it.
Sure.
And after we give you the vaccine, we're going to ask that you stay in the clinic for about 15 minutes after, just because some people can experience a rare but serious allergic reaction called anaphylaxis, okay?
Yep.
So the vaccine is going to be administered into your deltoid muscle, which is just a piece of your upper arm here, okay? Do you have any questions?
No.
Okay, do you consent to receiving the vaccine?
You bet.
Awesome, and do you have a preference as to which arm you would like to be injected?
My left one.
Your left one? Awesome. Okay, so I'm just going to check off the informed consent piece. So I'm going to get your vaccine ready, and I will talk to you in a couple minutes, okay?
Perfect.
Awesome. So I'm going to sanitize my hands. I'm going to cover my equipment as to not reach over my sterile field, and I'm going to grab my clean filter, and I'm going to grab my vaccine. I'm going to check that it's the right one. I'm going to check the expiry date. I'm going to date and time it if it hasn't been opened. If it has, I'm just going to check to make sure that it's not over the date. This is the vaccine that I'm going to be giving you. Perfect. Okay, awesome. I'm going to write down the lot number on this sheet. Okay, perfect. I'm going to agitate before I inject. Okay, I'm going to inject 0.5 milliliter of air into the syringe. I'm going to remove the cap. I'm going to inject into the vial. I'm going to remove 0.5 milliliter. I'm going to flick to make sure I get out all the bubbles that might be on the syringe. recap the needle. Gonna check to make sure that this is the right vaccine again. And put it back in the cooler bag. Sanitize my hands. Okay, so are you ready?
Yes.
Awesome. So I'm just gonna landmark on your arm where I'm gonna be giving the vaccine, okay?
Sure.
Awesome. Can you just lift your arm up for me? Okay. Okay. Put the orange there. Perfect. Now I'm just going to clean the area that I'm going to be giving the needle from inside to outside. And I'm going to leave that there as a marker. Okay, are you ready?
Yes.
Perfect. Once this dries, I'm going to use my index and thumb finger to pull the skin tight. And I'm going to inject on a 90-degree angle. I'm going to pause to make sure that no blood appears. I'm going to stabilize with my finger and thumb and inject. Okay, I'm going to remove the needle. Use my thumb to put on the safety cap and put into the sharps container. I will give you a cotton ball that you can place, and I'll tape the cotton ball on. Perfect. So we're just going to ask that you stay in the clinic for 15 minutes after, well, right now, just to ensure that you do not have a rare but serious allergic reaction, okay?
All right.
So at this time, I would finish filling out her sheet. I would rip off her piece and give her her copy and put this copy in the tray. Perfect. Have a great day.
Thank you so much.
You're welcome.